After opening the clinical research application framework, we are asked to enter our name and a password to sign in. After signing in, we will get the possibility to go for nephroblastoma or other cancers. If we are searching nephroblastoma, there will be the question, will a given nephroblastoma in a patient respond to preoperative chemotherapy or not? We then see a selection of patients, and then selecting one of these patients, there's the data shown. If we select these data, we can select between nephroblastoma multimodular hypermodel or the nephroblastoma phenomenological hypermodel. Selecting the multimodular hypermodel, we will see all the data that are able to give into the system, like the date of chemotherapy, or you see the tumor kinetic data, which are created by the different hypermodels which form the hypermodel. If all the data are correct, we can execute the model, and then after executing the model, we will go back to the page where you can select between the different cancer types, and you see here a new experiment has already started. In the system, there are other experiments already saved, and we are able to show you these different results of already saved models, and we can select here a model from Ernst Müller. This will now be uploaded into the platform, and we can show you the 3D visualization of the tumor by selecting the data that were created by the hypermodel. And you see the 3D tumor at the time of diagnosis. You can turn it around in the space, and looking at the timeline, you will see how the tumor will change over time during the preoperative chemotherapy. And you see a wonderful shrinking of the tumor. You will be able to store several pictures at different time points during the preoperative chemotherapy to use them in the report that we will create later on. Here we store at the time of diagnosis, after half of the treatment duration, and at the end of the preoperative chemotherapy. And we are now able to create a report, and you will see that takes a little while, and then you may recognize how the tumor will develop under preoperative chemotherapy. You see here the graph with the x-axis as the time and the y-axis with the tumor volume. You see how the tumor will shrink over time, and altogether over 89% of tumor shrinking in this case. You see here the pictures of the tumor volume at different time points as selected before, and you will get all the different data that were used in this model for this patient. The result can be uploaded to the CHIC platform, and you can also select another patient to compare results between patients, or even in the same patient with other data when, for example, the chemotherapy is given. And you can view this report here in the same patient but with another date of timing of the chemotherapy in the preoperative phase. Here you see the other curve of the tumor volume shrinking in this patient, which will be only 75%. And again, here are the tumor volumes that were selected for creating this report. Here the data that are used in this hypermodular model. So thanks you for listening.